Hello, everyone. Welcome to another one of our MaxWell Clinic webinar and group visit events. We are so excited and glad you are here. I think this could be a really good opportunity for us to all incorporate our paced breathing for the day. So before we talk about the complex nature that is women's hormones, why don't we all take a really cleansing inhale for 5? 1, 2, 3, 4, 5. And out for 5. 1, 2, 3, 4, 5. Release the day. Anything that hustle and bustle that you had going on before you were here, to dedicate your time to expanding your own knowledge base. And maybe you have some personal questions that we can address after. I look forward to digging in and getting started. So let's go. So this is an introduction to women's hormones, the good, the bad, and the ugly. I'm assuming that the predominant population of my patient audience today is female. However, if there's a few gents in the audience too, we welcome you with open arms, because the more everybody can be educated on this very rich and robust topic, the better. there is so much to understand about the beautiful and complex female body. So welcome. I have you all on mute, but if you have any questions, please type your questions in the question and answer box. And at the end of our time together, I will try to address as many as I possibly can. What I would ask of all of you to do is, as we're going through the different kind of highlights and high points, if there's a certain topic that you're like, oh, I really want to know more information about this, put it in the Q&A box and let us know, because what we'll do from here is, this is a great springboard to do additional webinars where we can go into more of the details with kind of the nuance aspects of the big umbrella that is the women's hormone topic. In the event that the internet goes down, I will switch to a hotspot, so stay on for 5 to 10 minutes. I will hop back on as soon as I possibly can. So we're going to start with the presentation outline, which is what we're going to cover together today. This is what I like to call the meat and potatoes. So we're going to do a broad overview of the female hormone lifetime arc. Broad overview is key. Women's hormones are complex, and there's a lot of different aspects to it. So each slide that we show and present and talk about today could be its own webinar presentation or 2-hour podcast or TED Talk unto itself. So realize that my goal and objective today is to just go through everything from a meta perspective, to really take a broad look at this topic in general, to hopefully provide some additional education, points of understanding, and maybe even elicit further questions for you to ask your MaxWell Care clinician, so that you can dive into things from a more personalized and tailored nature to really hopefully peel back that next onion layer of a possible component to maximizing your well-being. The next thing we're going to talk about is why hormones are so important and what they do. What do these things even do? What does it mean? PMS and Dr. Jekyll. Those of you who experienced that know exactly what I'm talking about. Menopause and the great reproductive transition. I know that there was a Broadway show at one point about menopause, and it deserves its own spotlight. Birth control, hormone replacement. Oh my, we're going to touch lightly on these topics and just kind of, again, broad overview. Common signs of hormone imbalance. And then lastly, 5 key strategies to improve hormone balance naturally that you can do right now and today, and starting at home. So let's start with your hormones and you, a beautiful life together in review. I bet most of you may not have known that in the beginning, whenever you were a developing egg, you were developing within your mother, who was a fetus, who was actually developing within your grandmother. So this is really interesting, because the environment with which your mother was birthed and her womb actually impacted you, and it impacted the egg development for what would eventually turn into the beautiful being that you are. So a little quote to help you understand this further is that every female fetus, including your mom, developed all the eggs that she will ever have while she was a fetus inside her own mom. And of course, one of those eggs ultimately developed into you. So in reality, you started your life inside of your grandmother. This is a revolutionary topic for some. And for those who know that different stress states, whenever a woman is developing a fetus, can impact all kinds of things. We have to not only look at the state of well-being of our mother whenever we were in gestation within her, but what was the state of our grandmother whenever she was carrying our mother? The way in which we are connected throughout the lineage of our family history is really important and impactful, and a really fun fact to start off with to understand the very, very beginning of how this all developed, because all of the eggs that are contained within your ovaries have a lot to do with different hormone signaling and how it affects your body. So, important bit to begin with. What a wonderful life your hormones and you have together. So let's go through it all really quickly. So there's birth and the egg creation, as we just touched on. So upon birth, you have all of the eggs within your ovaries that you will have for your entire lifetime. So as you're going through childhood, puberty stage 1, so this is actually Tanner stages for those of you who have any medical background, but the stage 1 of puberty is the child's appearance before any physical signs of puberty appear. So birth, infancy, toddler, all the way up to your initial signs of a developing body into puberty, we call that stage 1. So at that point, all of your eggs are still within your ovaries, but nothing's happening. There's no release or no signals for those things to occur. So stage 1 continues until approximately after our 8th birthday. At this point, the hypothalamus begins to send signals to the pituitary gland to begin to make and release luteinizing hormone, which is known as LH, and follicle stimulating hormone, which is FSH. These are two major players within the hormone life cycle. So, stage 2. This is the beginning of physical development. So typically around age 9 to 11, you'll have breast buds, a small amount of pubic hair. Internally, your uterus begins to enlarge. Now, the age at which physical symptoms of puberty has begun has actually decreased over the years, which is really fascinating. So we're seeing now that a lot of younger girls, even at age 8, 9, are starting to develop earlier than their mothers and grandmothers. And there's a lot of factors and a lot of theories around why that's happening. Environmental toxin exposure, early antibiotic exposure, especially in GMOs through our food, antibiotics through cow's milk. There's a lot of different factors in our water. There's additional hormones and things that didn't used to be there that are influencing and increasing the development rate of children these days. So another topic, but fun fact. So puberty stage 3 is when breast buds start to grow, armpit hair, and we've all been there, or have children, or young budding adults who are going through this at this time maybe. Hips and thighs start to expand, height increases. Stage 4, breasts take a fuller shape, pubic hair is fully grown, and this is when first menstruation, which is known as menarche, occurs, typically between the ages 12 to 14. Like I said a minute ago, this can happen earlier. As early as 9 for some young ladies, but this is sort of the very first stage of when our hormones start to take that regular monthly menstruation. Stage 5. So the final stage is usually around age 15. This is when periods have regulated. They're regular after about 6 months. Adult breast size usually happens around this age, and reproductive organs are fully developed. So then we have our years of fertility. This is approximately age 14 to 50. This is where there is a monthly menstruation when one egg is released within a month. I will show you that on our next slide, and we can visualize that together. But so to review, you're born, and within your ovaries, you have eggs. And all of the eggs you're going to have in your lifetime are contained within your ovaries. During your years of fertility, you will have really important key players. Luteinizing hormone and follicle stimulating hormone, we'll come to that in a minute, will help signal the release of one egg that then goes through the fallopian tubes into the uterus. And that is what you experience when your uterine wall will shed and you'll have your monthly menstruation. There's a lot of hormones that change and adjust during this time period. That's kind of a broad overview. So after the years of fertility, so menopause, perimenopause occurs whenever you can start to have symptoms. It's kind of like the ovary sputtering because they're running low on egg supply. So that's why irregular periods might happen. You might have one and then not have one for a few months and then have another one because, oh, there's another egg left, or oh, there's enough of a hormone signal to go ahead and release that. So it's this transition period and ending of the ovarian egg supply, therefore the cessation of fertility as well as monthly menstruation. And then postmenopause is that time period where menstruation has completed, and that is until the end of until death, essentially. So the monthly samba, this is the monthly dance that our body does. It's very interesting. So, and this is why estrogen and progesterone are things you will commonly have heard about or already are familiar with, because they dance with the luteinizing hormone and follicle stimulating hormone. So, follicular development. So the first day of your cycle down here, if you'll look as the sort of circular pictures shift, the body sends different signals to release an egg. What is left is during the ovulatory phase. What is left in the luteal phase is a whole different set of hormone signals. So in the beginning part of our cycle, we have estrogen that is taking the predominant hormone. As you can see from the blue arc here. As soon as the ovulatory phase is over and the egg is released, in the luteal phase, progesterone takes over. Now, if estrogen or progesterone are too low or too high, we can experience different physical symptoms because of the effects that it has on our body. We'll go into that in a minute. Again, this is just a broad overview. We could go into this slide alone for at least 2 hours. But this gives you a general idea of what occurs from the first day of your cycle through. They typically average cycles to 28 days. A lot of women cycle between 30, 32, and that's perfectly normal as well. Every human body is a little different. Hey, hormones. So why are they important? Well, let's talk about what they are first. So the two main female hormones that we've already referenced are estrogen and progesterone. Both are produced within the ovaries. Testosterone and DHEA are also present, however, in lower amounts. Testosterone is typically a predominantly male hormone. However, women have it as well. Other important influences, as we mentioned, are the luteinizing hormone and the follicle stimulating hormone. So what do? Well, first of all, they help create life, which is a miraculous experience. Our bodies, ladies, are incredible and beautiful, and they do amazing things within our vessels and beings. And because of these amazing hormones, human life is replicated and procreated, and the species lives on. That's pretty remarkable. So, can't tell. We're going to try to really love on our hormones by the end of this. So let's talk about what each one of them, the two main players in the female hormone landscape, do. So estrogen really focuses on regulating your menstrual cycle. It affects the reproductive tract, so vaginal wall thickness. Estrogen will decrease as you go into menopause, which is why a lot of women will experience vaginal dryness or just atrophy of the vaginal wall in general. It'll affect the urinary tract, the heart and blood and bones, breast, skin, hair, mucus, pelvis, and the brain. Estrogen is actually protective for certain neuronal brain functions, which is really interesting. Progesterone. So progesterone plays a key role in maintaining pregnancy. It prepares the body for conception and it regulates the monthly menstrual cycle. So estrogen tends to have a little bit more systemic effects than progesterone, but that does not mean progesterone is not equally as important, because it absolutely is. So testosterone. Testosterone, as I mentioned, is predominantly a male sex hormone produced in the ovaries in small amounts. Combined with estrogen, it helps with bone and breast health, fertility, sex drive, menstrual and vaginal optimization. Low testosterone levels, symptoms of that can be changes in breast tissue, fertility problems, low sex drive, osteoporosis, vaginal dryness, irregular menstrual periods. High testosterone levels, which a lot of you may be familiar with because that's typically associated with polycystic ovarian syndrome or PCOS, which is becoming more and more common. So that can leave you with acne, blood sugar regulation issues, excessive hair growth, infertility, lack of menstruation. And the thing about these sort of diagnoses and things that we've kind of captured is there's a spectrum. So you can be a little PCOS-ish and not necessarily have full polycystic ovarian syndrome, but your hormone profile can look a little bit in that direction, and there's room to optimize. Everything is really over a spectrum, and it's important to have it tested for you uniquely and not just go off symptoms. So PMS and Dr. Jekyll. No, you are not crazy. You're not crazy, although you may feel that way for a few days leading up to your cycle, and I completely understand. This entire lecture has been inspired by not only my own personal experiences, however, really near and dear friends of mine, and watching my mother and her own hormone journey throughout life, and just speaking to other women, realizing how common hormone influxes and how that affects how we filter in and are in the world are. So here's what I like to say. When the volume dial of our emotions does not match the situation, this is our body giving us an opportunity to discern how we really feel with grace and ease. So one of the key characteristics to mood swings and irritability that often come along with PMS is that you'll say to yourself, okay, so I don't know why I'm reacting this strongly, but it doesn't mean that you don't feel that way. And a lot of times we will get into a trap of invalidating our feelings because we'll go, oh, it's PMS, or somebody close to us will say, oh, you're just being hormonal. Well, it's really important to recognize that the root, the actual way we feel, may be substantially true. We should honor that. It just, volume dial might be a little out of our control. So it may just come across a little louder or a little bit more intense. But I really hope and encourage everybody to have an increased level of awareness and grace and ease with yourself, to take a few minutes to go, do I really feel this way? And if so, okay, let me reapproach, but I want to honor that and not just dismiss it, because even though there's a hormonal influence, what I may be experiencing is very real. So what is PMS anyway? Well, it's formerly known as premenstrual syndrome, a group of symptoms that women typically occur between ovulation. So that was about, ended around day, 14, 15, 16, until you actually have menstruation about day 28. So about 80% of women experience some symptoms in the days leading up to their monthly period. And guess what, you guys? It's not always the same symptoms, and it's not always at the same level of intensity, because we just couldn't be easy, right? So that's something that's really important for you to understand. They can be different and vary from month to month. So one month you might say to yourself, I am so bloated, I just need chocolate. And the next month you might feel weepy and teary, and the next month you might feel fine, and you might not have any symptoms. It's very unique. If these symptoms, which can manifest as physical, behavioral, psychological, recur and are severe enough to impact you on a daily life, then they're defined as PMS. And things like stress tend to make those symptoms worse. Just throwing that out there. So what causes me to feel this way? Well, after ovulation, when the corpus luteum begins to break down, the decline in progesterone levels towards the end of the menstrual cycle. So if you remember from our graph, the progesterone levels go up and then they decline before we have the uterine wall shedding occur. So the declining progesterone affects various chemicals in the brain, such as serotonin. Serotonin is our happy chemical that tends to keep our emotions a little bit more balanced. So women with PMS often have abnormal levels of hormones, and they appear to be more sensitive to the effects of the declining progesterone. If at baseline you have lower levels of progesterone anyway, you may be more likely to experience PMS symptoms, because then you're already starting at a place of deficiency, and then we're decreasing it even more with your monthly cycle. What are PMS symptoms exactly? So up to 150 symptoms have been identified as part of PMS. The most common are breast tenderness, bloated, headaches, acne, abdominal pain, fatigue. The most common psychological ones are mood swings, irritability, anxiety, depression, feeling tearful, upset, emotional, difficulty concentrating. Like I said, you're not crazy. This is your body's physiologic response to hormones shifting in a really natural way. So we just covered a lot about PMS. That occurs mostly in the fertility years. So now let's hit on menopause a little bit. A great reproductive transition. So what's menopause? Menopause is the time that marks the end of your menstrual cycles. It is officially diagnosed after you've gone 12 months without a period. Menopause can happen in your 40s or 50s. The average age is 51 in the United States. However, some women can even start perimenopause at the end of their 30s. It can last an average of 7 years. So this is a really critical time. This is a critical time to take really good care of yourself and work closely with your practitioner, because there might be a lot of ways we can support you to optimize this transition time. So when ovarian function declines with age, ovulation doesn't occur regularly. This leads to irregular or missed periods, as I mentioned. Eventually, the ovaries stop ovulating altogether, those darn ovaries, and periods stop completely. This results in lower levels of estrogen and progesterone production by your ovaries. So how does it affect the body? All kinds of ways. So hot flashes, sudden temperature spike that usually occurs from decreasing estrogen levels, night sweats, similar, associated with hot flashes, but you'll be in the middle of the night and you'll just wake up and you'll be drenched in sweat, fluctuating moods, irritability, problems with sleeping. Insomnia is not helped by the hot flashes and night sweats. Weight gain, frequent urination, so something to keep note of, also due to dropping estrogen levels. Stopping of your periods, lowered sex drive, painful sex because of the vagina tends to dry out more whenever there's low estrogen levels, vaginal dryness and bone fractures as well. It's really important, ladies, that whenever you are approaching menopause, that you have a DEXA bone scan to check your bone mineral density, so that way we can target our recommendations to support bone health as well as you get older. So what about birth control and hormone replacement therapy? Oh my. So what's the deal with birth control for hormones anyway? So birth control pills have been used in order to help with hormonal regulation and control. So let's talk about that just a little bit. So birth control pills provide a synthetic version of either estrogen or progesterone, or a combination of. These synthetic hormones can help regulate your menstrual cycle, decrease PMS symptoms, acne, cramping, and help support a healthy uterine lining in patients who have endometriosis. Because when we're adding in additional synthetic estrogen, progesterone, we're boosting the body's natural reserve, creating sometimes more of a balanced state, depending on your hormone levels to begin with. There are some risks. So risks include nutritional mineral imbalances, such as elevated copper levels, increased risk for blood clots, serious one, especially in our COVID times. As we've learned about COVID, it affects the vascular system and it can increase blood clotting risks. So you add birth control and long-term birth control use on top of that, and it's something to be concerned with potentially. Increased risk for cervical cancer. There's mixed results on whether it's an increased risk for breast cancer or not. Data kind of goes back and forth on that. So it's best to optimize hormones naturally versus adding in any synthetic hormones if possible. We will use any tool within our toolbox in order to help you optimize and function at your best. If we have to go down that road, it's not that they're evil. It is a tool we can use. However, we try to avoid using synthetic hormones at any possible turn, because optimizing your body naturally is our best bet and first selection. Hormone replacement therapy. You might have heard a lot about this. So hormone replacement therapy primarily focuses on replacing the estrogen that your body no longer makes after menopause. However, we often utilize combination hormone replacement therapy to optimize hormones in the perimenopause and menopause for a short duration. So we typically use combined hormone replacement therapy for women who are going into the perimenopause and then through the menopause transition, and then potentially for a few years after. What combination is used depends on baseline testing and symptoms. If women still have a uterus, it is important to never take estrogen by itself. You always take estrogen in combination with progesterone. That's really important. The reason why is because when estrogen is taken alone and not balanced by progesterone, it can stimulate growth of the lining of the uterus, and that can increase the risk for endometrial cancer. So if you have had your uterus removed via hysterectomy, you may not have to take progesterone, but that will all have to be guided by your clinician. So combined hormone replacement therapy most commonly comes in the form of topical cream, drops, patch, or vaginal creams. And we've found in our experience, it can be really helpful for that transition period of time as far as to manage symptoms and help preserve some of the things that we know estrogen does so well, which is helps with bone health, brain health, focus concentration, decreasing hot flashes. It's really great. It's a great option. So the benefits, as I just mentioned, preserve brain function, osteoporosis, hot flashes, helps with vaginal dryness, loss of libido, helps with depression, irritability, and sleep. The risks include an increased risk of breast or endometrial cancer, blood clotting, because we're adding in estrogen, stroke, or heart attack. The key important thing to know about hormone replacement therapy is that you want to make sure you're using bioidentical hormones and not synthetic hormones. We want to match what the body is producing naturally on its own as closely as possible. Hormone imbalances, so common signs. Hormones, is that you? Common symptoms of possible hormone imbalance include mood swings, breast tenderness, heavy periods and cramps, hot flashes, anxiety, fatigue, sleep disruption, low libido, polycystic ovarian syndrome, acne, infertility, facial hair, weight gain, hair loss, brain fog, endometriosis, uterine fibroids, and surprisingly, gut symptoms. IBS symptoms can also be associated with hormone imbalances. So a lot of things hormones can affect. So why is that? Well, for those of you who have researched this already, we have come to learn as science has progressed that the hypothalamus, which is located in your brain, pituitary, adrenal, thyroid, gut, immune, and gonadal axis. Wow, what does that mean? That means they're all connected and they all affect each other. Oof, I know. It's not simple. It is not a straight line. We used to think that just the hypothalamus affected just the ovaries, and that was it. It was just a linear north-south type of relationship. We have come to find, as you can see from this illustration, that there is interplay between inflammation, your adrenal glands, your thyroid, insulin levels, your ovaries, your gut, your liver, your brain. You are one very well-connected system that can affect hormone regulation and balance. So known possible triggers and mediators that affect optimal hormone function. Chronic stress always comes back to this, doesn't it? It does. Gut health, nutritional insufficiencies, extended toxin exposure, so pesticides, BPA, a poor diet, food and allergy intolerances, poor methylation, mitochondrial dysfunction. Mitochondria, for those who do not know, is the powerhouse of the cell. It is responsible for a lot of our energy production in our cellular being. History of synthetic hormone use can actually, so that would be birth control, can affect optimal hormone function in the long term. History of physical or sexual abuse, inflammation, infections, toxins, and trauma. I bold those because that's a really good overview to remember. Poor sleep, genetics, alcohol, and smoking. So a lot of different things can contribute to a suboptimal hormone balance. So what do we do about it? Well, I've got 5 key strategies to help optimize your hormones naturally. However, I'll emphasize right now and at the end, it is super important to work with your MaxWell Care clinician or whichever clinician that you are currently working with to make sure that your specific and unique needs are taken into account, because every woman's body is very different and how you respond to different things will be different as well. And getting to the root cause of what could be at the head of the cascade that's causing imbalance is really important. So number 1 is stress. We're back to that again. So reduce stress whenever possible. Stress and chronic stress has a huge influence on your hormones and how they function. Add in daily meditative or reflective time. That can be 5 minutes. Paced breathing throughout the day. We started this webinar off with some paced breathing. It's really easy. You breathe in for 5 seconds, hold it, and then breathe out for 5 seconds. Box breathing would be breathing in and then holding it for 5 and releasing it. However you want to do that, very powerful to regulating your autonomic nervous system. Practice gratitude and mindfulness. It's amazing what a moment when you're feeling frustrated and you just think, what can I be really grateful for right now? How that will shift your stress very quickly. Where is your whimsy? This is a word that I love. Where are you being whimsical in your day-to-day interactions? As you're sending those emails, as you're accomplishing those tasks and talking to your coworkers or managing your family at home and taking care of your beautiful children, are you being playful with it? That can decrease stress immediately, because stress and being whimsy and whimsical in life don't tend to happen at the same time. Play more, overanalyze less. We are in our heads all the time, and we have a lot of reinforcement for that. Try to be in your body and be as present as you possibly can, that your life and body and those around you will thank you. Practice boundary setting and the value of enoughness. So we tend to think of boundaries as from a reactive state of no, get away from me, I have to protect myself, which is just fight or flight in a different form. What I'm suggesting is that if you feel that you have enough and that you are enough and that you will always find the resources to be able to do whatever task you need to do, boundary setting will naturally occur for you. It will come forward because you'll be coming at life from a place of and ease. And so saying, I don't think I can be able to get to that. And releasing it versus having it be another thing on the to-do list that you feel like you haven't accomplished, therefore you're not enough. Really, really big shift in life. So know that life is both the max and the well. There's our name. It's both the acceleration and the rest. So living in that place of high amplitude back and forth can decrease stress levels. And ask for help and stress support, especially with any traumas. EMDR therapy is great. There's a ton of resources out there. We are not in this alone. We are a community of souls going through life together, and it is really important to reach out in relationship. Number 2, sleep. So sleep is very important in hormone regulation. Make sure you turn off your screens at least an hour before bed if you can. Blue light blocking glasses is a great thing to use towards the end of the evening. If you're going to watch some TV, you pop those suckers on and it'll signal to your brain that it's still time to shut down and go to bed. Wind down, have a nightly routine if it works for you. Meditative and reflective time before bed. This is a great moment for daily gratitude. Epsom salt baths, very relaxing, increased intracellular magnesium, better sleep. Add an additional magnesium to support sleep. We have a product called MemberMag. 1 to 2 scoops at night works wonders. Magnesium threonate crosses the blood-brain barrier, so it can help spark those neuronal pathways for working more efficiently during the day as well. Super helpful. Melatonin, even a low dose, 3 milligrams sublingual at night, decreases inflammation, increases sleep quality for many, and can help with overall hormone regulation because you're sleeping better. Exercise is huge for helping you sleep. And then decreasing caffeine and alcohol intake. Try to limit caffeine to before noon, and alcohol is actually better if consumed during the day versus at night before you go to bed, even though I know it's not our current social patterning, but your body will thank you to be able to have the time to metabolize that and then get to sleep. Number 3, regulate inflammation. Inflammation has a big impact on hormone regulation. So how you can do that easily? Reduce or eliminate added sugars. I'm talking no added sugars. The only sugars you should be consuming are those that occur naturally in fruits or vegetables at best. Some alternatives, stevia and monk fruit extract and xylitol are acceptable. They don't tend to boost your blood glucose levels. Those do not tend to contribute to inflammation. So you're okay there, but you still don't want to overdo it. Make sure you're adding those bitter flavors and savory dishes into your diet. Reduce or eliminate gluten and dairy. Gluten and dairy are very inflammatory. Alcohol is as well, so reduce or eliminate that. Sufficient high-quality fish oil supplementation is huge for inflammation and also hormone regulation. So we have a product called Omega Clean Mono Max 1300. 1 capsule twice a day is sufficient if you want to do a little sprint to really decrease your inflammation quickly. 2 capsules twice a day for a month is awesome, and then you can decrease down to 1 capsule twice a day. You want to target gut health. Inflammacool is a product we have. 2 scoops a day is great at healing and sealing the gut. So if you do take away added sugars, take away dairy and gluten, eliminate or reduce alcohol, add some fish oil in and some inflammacool, your gut will be happy. Exercise and reduce stress will reduce overall inflammation as well. These are just some foundational recommendations. Of course, you want to make sure you clear all of this with your MaxWell Clear clinician before you dive in. Fast. So really interesting. One of the most significant data points in recent research has found that daily intermittent fasting can have profound effects on the body's natural hormone regulation optimization. So much so that in my recent training module on hormones, there was one of the physicians shared that one of his secret weapons for getting women to feel better faster is intermittent fasting. So Really easy, super inexpensive to do and try. How you accomplish this is you begin with a 14-hour fasting window each day. Typically that means, let's say you have your last meal of the day at 7 p.m. So you would wake up the next morning and not eat until 9 a.m., let's just say. A lot of people will skip breakfast altogether and go to a 16-hour window of fasting and an 8-hour window of eating. Again, be careful and gentle with yourself. Work with your clinician in order to get specific recommendations for you, because there may be other things that are a part of your case that would make intermittent fasting not be a great idea for you. But as a general rule of thumb, it's a great, easy, fast tool and strategy to implement to try to help with hormone regulation naturally. And, oh, number 4 twice. This is number 5, supplement. So for supplements, for symptoms associated with PMS or menopause, we have a supplement called FNP-C. 1 to 2 capsules twice a day tends to have really great effects for regulating the sort of estrogen progesterone swings that occur. And a lot of women have success with this particular product. For stress or sleep mediated hormone imbalances, ashwagandha 35 is a great product. 1 capsule twice a day, starting off with that is wonderful. For stress mediated hormone imbalances or PCOS, Restorade 1 to 2 scoops twice a day. So PCOS, those of my ladies out there who have that, Restorade is amazing. It has inositol in it, and it's great at helping to target your specific hormone profile imbalances. And for inflammation-mediated hormone imbalances, we already mentioned this, but Omega Clean Monomax 1300, 1 to 2 capsules twice a day is great. So I've listed a bunch of recommendations. However, I'm going to emphasize again, make sure that you ask and work with your MaxWell Care clinician before making any changes to make sure you're doing what is safe and best and right for you and your body. So digging in, how to better understand and tailor recommendations for your individual body. MaxWell Care is your partner for progress. So as I've said so many times, work with your MaxWell Care clinician to take a personalized approach to hormone assessment, as well as make tailored recommendations for you. As with everything we do at the MaxWell Clinic, no one patient evaluation or recommendation is the same, as each individual is sacredly unique. That is something we cherish and deeply value. Any questions? That is it for me. I do not see anything in the Q&A, so I think that wraps up our introduction to hormones. After you watch this, for those who are watching the recorded version, please let us know of any hormone topics that I briefly hit on that you'd like to know more information about. That'll help guide our topics and webinars in the future, so we can get the content that is most relevant and relatable to you moving forward. I hope you all have a wonderful evening or morning, whatever time you're listening to this. From all of us at the MaxWell Clinic, we wish you well and wellness and thriving for many days to come. Be well.